We are known here in Delaware as the first state. We've been very lucky with this, the spread of the coronavirus disease not to be one of the first states that's had to deal with it. We've had the opportunity to learn from other states. I've been on conference calls with my colleague governors, with Vice President Spence in the White House, and coordinating how each state has responded. And we've been getting better every day and every week. I first want to thank the staff at the Division of Public Health, Dr. Rattay, who you're going to hear from in a minute, the Delaware Emergency Management Agency, A.J. Shaw, who's with us, and all the other agencies that have been actively preparing for weeks for the possibility of a coronavirus disease appearing here in Delaware. And this afternoon, I'm announcing that, unfortunately, Delaware has joined the growing list of states, I think about 37 or 8, with confirmed cases of coronavirus disease. Our first confirmed case is a Newcastle County man over the age of 50, and I will let Dr. Walker and Dr. Rattay provide more details about this individual. What I can tell you is this: in this case, the collaboration between the healthcare system and the Division of Public Health has worked effectively. Our medical providers are absolutely our frontline defense against this disease, and I greatly appreciate their ongoing dedication and work. Our Division of Public Health ran the test in our lab in Smyrna, which opened just this past week, resulting in a presumptive positive test result. The CDC will confirm that result, as it's doing with tests across the country. As I said at the top, we've been expecting and planning for this for weeks, and we're ready. I've asked Director Shaw and DEMA to coordinate a government-wide response to ensure that we were able to keep our citizens safe in the least restrictive way possible. We're taking this extremely seriously because it's a serious matter, but we are not panicking, and neither should you. Moments ago, we issued guidance to state employees to let them know more about what to expect in the coming weeks, and this is an evolving and will continue to be an evolving situation. The Division of Public Health's website, de.gov/coronavirus, and its hotline number, 866-408-1899, has been busy fielding questions and concerns for the past week and will continue to do so. As a new disease, information is changing constantly, but precautions and preparations are important to mitigate the impact of potential community spread of this disease. And that's where we will focus our efforts. And so I encourage all residents to do their part in reducing the spread of this and any other respiratory illnesses. Please stay at home when you're sick and avoid other people. Cough or sneeze into your elbow and not your hand. Wash your hands frequently and thoroughly with soap and warm water, including the backs of your hands and under your fingernails, and clean surfaces that you use often. Do not touch your face. I noticed the other day that I touched my face a lot more than I thought I did as I tried to stop doing it. Your eyes or your mouth with unwashed hands. Reduce contact in which you can transfer germs, including adopting a no handshake policy, which is why I elbow bump everybody now. We realize that citizens and especially parents and employers are concerned about the impact of this disease and that will have on their day-to-day lives, on our schools and our businesses. The Division of Public Health will continue to work with healthcare facilities, with our school superintendents, the chambers of commerce and businesses, long-term care facilities, because the elderly, in particular those with healthcare problems, are at particular risk in reviewing their plans in case COVID-19 spreads in the community. As I said a minute ago, that's what we want to prevent. We are recommending that employers in the public and private sectors review their plans to ensure that they can operate with adaptations such as teleworking and flexible sick leave policies, as well as how to respond if an employee becomes sick. We will continue to monitor the situation, and as I said, it will be an evolving situation as it has been in other states, and we will respond accordingly, led by A.J. Shaw and Dr. Rattay, Division of Public Health, and DEMA. Finally, I understand that this news will leave many Delawareans anxious and possibly afraid. And as your governor, I commit to you that we will provide you with consistent updates through our website, de.gov/coronavirus, through community partners and social media, and during press events like this. Our team will be meeting every day, as they have for the past couple months, to monitor the situation. The most important thing we all can do is this: listen to the advice from the Division of Public Health and DEMA. They are the experts, and they're going to lead us through this, and we're going to follow. They are entrusted with protecting the health of every Delawarean and keeping us all safe. I would ask you all to be vigilant and to be careful in your day-to-day activities. As I said, this is an evolving situation which we will continue to respond to accordingly. Now I'd like to introduce and first thank our Secretary of the Department of Health and Social Services, Dr. Walker, for her leadership over the last several years, and in particular the last several months with respect to our response to this disease.
Thank you, Governor. As a health official, this is the day that we expected to happen in our state, and one that the Division of Public Health and other state and community partners have spent weeks planning for. We are ready with our response to the first confirmed case of coronavirus disease in Delaware. Because this virus is new, we recognize that people are scared. We all feel the anxiety in the community, in churches, in the barbershops, in school hallways, in our places of work. We will do everything in our power and in coordination with federal and local officials to keep Delawareans healthy and safe. I want to thank congressional delegation members, state legislators, and local officials for their assistance and support that we are receiving from them. We will keep you informed about the cases we are identifying, the availability of testing and medical care, and how you can help yourself and your family stay safe and healthy. If you're worried about a loved one's medical condition, please call your doctor for guidance. If you have a general coronavirus-related question, you can email dphcall@delaware.gov. In addition, after today, we will likely be expanding the hours of our public health call center. That number, for anyone who needs it, is 1-866-408-1899 or 1-800-232-5460. Our job at the Department of Health is to control the spread by isolating people with the virus so they can't infect others. Our Division of Public Health and our entire healthcare system is experienced at doing this, but all of us need to help them. We all need to do things to reduce our risk for contracting COVID-19. Things like changing the way we greet each other, our daily hygiene habits, staying home from school or work when we are sick. And particularly if you are 60 or over or have a serious or chronic condition such as heart or lung disease, diabetes, or cancer, you need to do the following, please. Stay away from crowds as much as possible. Avoid non-essential travel, such as long plane trips, and defer all cruise trips worldwide. Stock up on supplies, including your medications, food, water, and other household items. And have a plan in the event that you do get sick, and that you discuss this plan with household members, relatives, and friends. To help alleviate anxiety and fears in the community, we will offer updates as often as we can to share information with the public and help guide decisions that families, workplaces, organizations need to make. We encourage you to get the latest Delaware updates on our website that's specific to coronavirus at de.gov/coronavirus. Now I'd like to introduce Dr. Carol Rattay, who is leading our efforts of the Division of Public Health to offer more specifics on our first case and on our response. Thank you, Dr. Rattay, for your leadership.
Thank you, Dr. Walker. As the governor stated, the Division of Public Health has received a positive result for coronavirus disease 2019, or COVID-19, in a case involving a Newcastle County man over the age of 50. The individual is not severely ill and is doing well. He self-isolated at home as soon as symptoms appeared. The man, who is affiliated with the University of Delaware, was exposed to a confirmed case in another state. We will not be disclosing any additional information about this individual. Epidemiologists from the Division of Public Health are working to identify close contacts of the individual and will contact them directly with guidance. We understand that the news of a positive case in the state is concerning, but this is something that we have been preparing for over the last several weeks. The symptoms of COVID-19 are most similar to lower respiratory infections, with patients having fever, cough, and shortness of breath. 80% of people who contact COVID-19 will experience mild symptoms. If the disease were to spread throughout the community, while many people would get sick, most people will not get seriously ill. There is no antiviral treatment recommended for COVID-19 infection at this time. And while in some cases illness can be severe and require hospitalization, many individuals infected with COVID-19 recover by resting, drinking plenty of liquids, and taking pain and fever-reducing medications. In addition to this positive case, DPH is currently monitoring 31 persons who are returning travelers from mainland China and Italy. Anyone who has returned from travel from a country with a level 2 or higher travel alert, which at this point includes China, Italy, Japan, Iran, and South Korea in the past 14 days, and has developed symptoms like cough, fever, shortness of breath, should contact the Division of Public Health call center at 866-408-1899. These returning travelers, again within the last 14 days from these countries who do not have symptoms, are also asked to call DPH at the same number, 1-866-408-1899, so that we can provide guidance on self-monitoring for symptoms and what to do if you develop symptoms. Returning travelers are asked to stay home for 14 days after returning from travel. That means no work, no school, and avoiding large gatherings. I want to remind people that there is no indication that wearing surgical masks is an effective prevention measure for the public. Additionally, if you are buying surgical masks for personal use, you are making it that much harder for medical providers to get them. Hospitals are preserving their personal protective equipment, like surgical masks, and building protocols for appropriate use. DPH is providing personal protective equipment, or PPE, stock for hospital training purposes. And DPH is working very closely with the Centers for Disease Control and Prevention, hospitals, clinicians, and other providers to proactively identify and respond to any possible cases of coronavirus disease. We will continue to keep the public fully informed as additional information becomes available. Our recommendations and the number of persons we are monitoring, along with patients under investigation, can be found at our website, de.gov/coronavirus. Businesses, schools, medical providers, individuals, and community organizations can download our flyers and view the most current information at this site. I thank you very much, and I will hand this back to the governor.
So I, again, would like to thank Dr. Walker, Dr. Rattay, and A.J. Shaw for their continued leadership. We've been preparing for this, as I said, for about 2 months, and we will continue to meet and to continue to respond to this as an evolving situation. I would just ask all Delawareans to follow the advice that has been provided today, to get additional information on the website at de.gov/coronavirus. There's also information at coronavirus.gov at the federal level. And obviously those of us who are elected officials are out in the public all the time answering questions. We will have, we'll break up now and have individual questions by members of the media. Thank you all for coming, and stay safe.